I am seeing about 2 to 4 patients a week of complications with pigment alterations. And these are patients with a skin of color, ethnic skin patients that have had issues with either hyperpigmentation or hypopigmentation, or even scarring and keloid due to some cosmetic procedures that are being performed elsewhere. I think we need to do a lot of education, not only in the dermatology community, but to all the other doctors that are performing these procedures, that if they are going to do these procedures, they need to understand the differences in treating ethnic skin, starting with basics, starting by understanding the morphological difference, the physiological difference, that these people, that these darker racial ethnic groups, not only African Americans, but Latinos, Middle Easterners, a lot of people with darker color skin, there are differences in the amount of melanosomes they have and the amount of pigment that's in their skin, so they have to be treated differently. And understanding the basics, after that they need to understand the different procedures they're going to perform and how to prevent pigmentary alterations in these patients. And if you're prepared, pre-treat these patients. If they were to develop any of these complications, you need to, of course, know how to treat them as well. Let's talk about, for example, chemical peels. If you're going to perform a chemical peel in a darker person, do a little test spot, see how they react. Because if they have a lot of redness, a lot of erythema, this means that they're going to eventually develop inflammation, and inflammation leads to hyperpigmentation. If you're performing a procedure like lasers, for example, do a little test spot, make sure, get a family history, look at their genetics, because they might be light complected, but their family member might be very dark, and they might have problems with either scarring or keloid formation. So with peels, you could all do a test spot. With lasers, you can also do a test spot. Get a good history, look at their ethnic backgrounds, look at their skin color, their Fitzpatrick photosensitivity is important as well. And then if they do have a history of prior pigmentation, make sure you prep them with either hydroquinone, preferably for 2 to 4 weeks. You could also pre-treatment with retinoids 2 to 4 weeks before your procedure to prevent the incidence of post-inflammatory hyperpigmentation. So the key message is, when you're treating these skins, be careful, be conservative, don't be aggressive. If you're going to do a peel, start at the lowest concentration, the lowest time frame. If you're going to do a laser, do the less amount of energy, the less number of passes. So be conservative, don't be aggressive, and then know and understand the nuances and the differences in treating patients with ethnic skin. I think the important thing is the number of people with darker skin types is going to be rising. We know when we look at the US Census, over 50% of the population is going to be skin of color, so you are going to see a lot more of these patients walking in through the door. So educate yourself, learn how to do these procedures, learn the differences in treating these sensitive skin, and then I think it'll be a win-win situation for your patient and for the doctors as well, getting successful outcomes.